hello, everyone. I'm really happy to be here. I've been with Riverside University Health System Behavioral Health, which is fancy for Riverside County. I've been with them for 16 years as a peer support specialist. I'm currently the deputy director of peer support services. And what's cool about that is now I'm on the executive committee. So all the executive decisions that go up to our director are made by the committee, and I'm a member of that committee. So there's a peer on our behavioral health committee, which is very executive committee, which is very cool. And I'm very honored and feel just really blessed that I'm able to do that. So to just start this thing, I want to ground us a little bit. I want us to sit in a space, if we can, maybe put our feet flat on the floor, maybe hang our hands down or set them to our sides or get into a place, because we just have people are eating lunch or they just had lunch. And I want us to, if we can, just close our eyes for a second and breathe in our sense of hope and breathe out the things that hurt. And then breathe in remembrance and breathe out the things that hurt. Breathe in our resilience and breathe out loss. And sit in a space of hopeful remembrance and understanding our resiliency. I want us to tap into that because there are things that we're going to talk about in this class that are going to bring up thoughts, going to bring up some really, probably some gigantic feelings. And so I want us to be prepared for that because I wasn't prepared for it when I started writing the thing. So I'm speaking as a peer and saying that reflective thought about things that have occurred with us, to us, for us, around us can be difficult. So if we put forth our own hope and resiliency, we can listen with that. And I want us to be listening and thinking in that. And when you're ready, please use your reaction button and raise your hand and tell me when you're ready. All right. Looks like we're ready. Okay. So our agenda is, I'm going to touch on some things, and I just want to say them here so you know that these are the things I'm just going to pretty much cover or talk about. Pre-pandemic peer support. Where were we, before the pandemic hit us and everything around us? And then I'm going to talk about the benefit of having a peer support infrastructure in your agency, equating to hope, and how hope gets lost when that infrastructure isn't in place. And I'm going to talk about that briefly. Then I'm going to talk about pandemic era recognition of our resiliency, the things that we've learned about ourselves that bring forth the fact that we are resilient and we do have abilities, and there are things that we can do and did do and have done since that have put us in a place of being effective peer supporters and honoring that. And then I'm going to explore the human condition. I'm going to talk about what happened to us. And then I'm going to talk about organizational change and how organizational change was in high gear and how high gear hasn't slowed down because we're still in high gear. And so I'm going to talk about that too. And then the last thing is embracing what is to come, which is difficult to do if you're a person who's struggling. So I'm going to talk about these things. So the first thing I'm going to ask you is, what was going well for your peer support program before the pandemic hit? And just put it in the chat. Just type in like a quick sentence. What was going well? Strange. Oh, hold on. There it is. Hold, please. I have to look to the left. Okay. All right. We had 5,000 visits a month. Lots of consumers. You can raise your, oh, there you go, raise your virtual hand. Okay. Lots of consumers, lots of people that were coming to see you. In-person peer support and interaction. Pleasant environment. I didn't start until after the pandemic. Oh, okay. Thank you, DC Smith. Any other things that were going well before the pandemic hit? We held trainings in person. Yeah. The peer support team was growing as part of the mental health field. Oh, yes, it was. Yes, it was. What else was going well? People were not afraid to leave their homes. Of course they weren't. What else? Any others? I love your feedback. Okay. So what was going well for us? I will tell you for us what was going well. Our team, we had a full team. People were coming to work. They were participating in everything that we offered. They were integrating into programs where they hadn't been integrated before, like our mobile crisis teams. There were things that were happening that were going really well. We were on the precipice of the peer certification process, where I had been involved since, the Working Well Together group, So there were a lot of positive things that were happening before the pandemic hit. So I want to talk about peer support infrastructure and how it equates to hope. So in 2020 for Riverside County, we were launching the CalAIM, right? Public. Oh, I got a hand. Angeline, do you have your hand up? I can't hear you if you're off mute. Okay, I saw your hand. So if you have something, put it in the chat for me and I'd be happy to answer. So in Riverside, we were with the launching of the CalAIM thing, and I don't know if you've heard about that, but this is huge funding that's coming to behavioral health systems, or has come to behavioral health systems in public behavioral health. And it was in the throes of this push for statewide change around how we see the human in front of us and how we meet the needs of the human in front of us. And that was the very beginning of this. And before the pandemic actually hit and everybody was leaving and there was this mess, our organization had some goals around how we were supporting our peer program as the CalAIM changes were occurring. Okay. So when we talk about organizational leadership, right, that organizational leadership for us, there was a buy-in. There was this big buy-in, like, okay, peer support is part of CalAIM. Peer support is being shown in the behavioral health information notices that we're getting from the state of California. So there's big buy-in to do this thing. When most of us were building our peer support programs, it's important that our systems organizational leadership was focused on making sure the environment in that organization was supportive and positive about bringing people with lived experience into service provision. Because in some public behavioral health circumstances, there's pushback, right? Stigma and all the other things that have followed us for years and years still there. And history tells us that without that support, peer support programs can be really disjointed or contracted, and there's these silos where people are not talking to one another and the collaboration is gone. And what happens is that those peer programs lack credibility from the outside. We know we have credibility. We know what we do is effective. We know that it supports change and better outcomes for the people that we serve. This foundation, we were really working hard to get this messaging across from the top of our organization that we are supported, because we do have an infrastructure. We have a management team and we have leadership peers. We have mentors. We've got, peer support specialists that are working out in the field, or they're working at clinics and they're integrated in all these programs. However, some systems were not doing that. So peer support infrastructure is something that people had been thinking about but hadn't done. And we were just starting to do all of that. And then with Colleen, we were thinking about the peer career trajectory. What does that peer job look like, and what does growth, development, and salary increases and more responsibility look like? So we had a peer career ladder before most people did, but we needed to solidify some of the things that were in that ladder and create an infrastructure that was supported from the top down. And hence the fact that I'm now a deputy director, that foundation is actually at the director's table. So these were things that were in play. So then we see the laws change. The passage of SB 803, right, which legitimized the peer support function, the peer support role, the peer support responsibilities, the core competencies of the practice were validated through SB 803. And they were defined. They were defined for us. And so with that definition, those definitions were placed inside of these behavioral health notices we got from the Department of Healthcare Services, right? This is what they do. This is what they look like. This is their responsibility. This is their code of ethics. And we'd never had that before, right? But we had just gotten, those things were starting to happen. Then we got practice guidelines, and those practice guidelines came from having the entities that were going to be peer certification entities, training entities, have to pass muster, if you will, with the contracted agency that was actually overseeing the certification training process. So there were all these things started happening when the pandemic hit, all of this stuff. And then we had to have training and mentorship. Training had to be standardized, and it was standardized by the state because there was going to be an exam that we'd have to take. And the training is not just for peers, but it included the supervisor. Like, hey, supervisor, you have to know what this practice is. We have to know, you have to know what is expected of them, so you're not asking them to step outside of their role. And then the administrators and directors and deputy directors have to read the behavioral health notices. They have to know what the state is asking for. So even though everything stopped, these things are all part of an infrastructure that is supposed to be helping the peer workforce move from this sort of informal role on a few teams to, you need to be part of the system as it is and be recognized for that. And with that, we had to have other disciplines. As with other disciplines, we were thinking, well, we need to have mentors for folks who need to rise on their career ladders. We had to make sure that we had somebody who could work in a non-punitive role with a person so they grow, because usually it's the supervisor and telling you you're doing something right or doing something wrong. And so having mentorship was a part of that infrastructure. And then the last thing I want to say is communication. When we were planning our peer programs, it became very, very clear early on that communicating the planning, the development, the implementation, the processes are communicated with the many systems, with the organization. The resource of the peer provider wouldn't become more easily recognized and utilized on the ground if we hadn't done that. Because we know that with foundational and infrastructural things in place for the peers, we're going to have hope for better outcomes. So then everything stopped. Okay, so then everything stopped. So these are the things that we were all working on. These are the goals. I think that many of you probably shared these types of goals at your agencies. These are things that were all going on before, but when everything stops, now, this is where we have to bring in our hopeful remembrance, right? Our resiliency. We have to think about this stuff. I'm going to ask you to go back in your minds a little bit to when everything stopped. I know for me, all in-person work as we knew it was gone. We couldn't be in person. We couldn't be in front of the people that we serve. Now, I need you guys to know this personally. I never left. I came to work every single day, and I worked at a medical center. I provided support to families who were saying goodbye to their loved ones. That's what I did. And I walked people into the ICU to say goodbye one at a time. That was a very hard time for me. And I want to say that I was pivoting. We were all improvising because nobody knew what to do next, right? Because everything just stopped. We had to learn new things, and we were all feeling the pressure. So I'm going to ask you, where were you? Think about, where were you when everything stopped? Where were you in your work life? Where were you in your personal life, or in the things you were working on, the state of your recovery, the recovery of the person that you're close to, whether it's a child or a spouse or a friend, the state of their recovery? Where were you in your community activities, your day-to-day life, your relationships? These are things I ask because I know where I was. I can tell you that. And I think by sharing that, maybe it will bring forth the things in you that you were stopped. I will tell you that where I was the administrator of our peer programs. I wasn't a deputy director yet. And I had only been an administrator for a couple of years. And then I was asked to be on the Cal-AIM steering committee when everything stopped. So they told me, we want you to be part of the Cal-AIM steering committee. I was excited about that because Peer Voice would be at the table from the get-go, right? So I was super happy about that. And then I had just recently taken in a trans youth as a foster, and she still lives with me now. So there was a lot going on at home in terms of change and getting used to having another person in my house and having another person to care for. That was another thing. I was working on our peer certification curriculum because I knew that they were going to ask people to contract to be agencies to train. And I wanted us to be one of them because we have such a large peer workforce. I wanted to be able to train our own people. I know that I was well. My mental health was really good. I was feeling good. I was feeling focused. My mother was declining in health. My children were both working. I was neglecting my social life. Absolutely neglecting my social life. I was overworked and leaning on old workaholic behavior. So being well and still doing things that are outside of my wellness were happening at the same time. My husband was super supportive of everything I was doing, like he always is. He's the most patient person on the planet. I was dealing with toxic biological family. I was having interactions with my family that were already toxic because of my mother's decline. And I was at a place of where I'm done, with those toxic family. I was at that place where I was like just on the edge of I'm done, right? But I wasn't there yet. I didn't say it. I didn't do it. I didn't look, whatever. So that's where I was. So I'm telling you all of this because I know that there was minute by minute change, things that were happening to us, with us, in our lives, all within our lives. There was this minute by minute change, and we were receiving all kinds of messages about minute by minute change, all kinds of messages. Now, if you could please use the chat and maybe type in a message that you got during this minute by minute change when the pandemic hit, when we were actually shut down. Let's see. Anything in the chat? Okay, so my organization had never shut its doors since January 1st of 1993. We were open every day. We suddenly had to move all our trainings, self-help support groups, and staff meetings to take place online. My house was not set up with a home office. I couldn't visit my parents, who were ill. A bunch of my colleagues quit. It's huge, right? What other minute by minute change? Is someone else willing to share? Thank you, Libby.
Sure, Shannon. It was rough.
Yeah. It was really rough. So I don't see anything else in the chat. So if somebody wants to say something, go ahead and raise your hand. Okay. All right. So what I'm going to say is there were media announcements about locking down. right? Or not locking down, or, oh, I got a hand. Kelsey, go for it.
Thank you. I was starting to type, but I was actually an art teacher at the time and I wasn't doing well. And then having to be home made me even do worse, right? And, I'm a recovering alcoholic, and that was the height of my, drinking and using. And so in a lot of ways, I'm grateful for, what I went through with this big change in the pandemic, because I don't think I ever would have realized I needed help. And then ultimately had a big career change. And, that's a big part of my lived experience. Getting sober enabled me to actually look at my mental health conditions. So I'm doing so much better now.
Oh, I'm so glad to hear that. Such a
Thank you.
wonderful message, Kelsey. Thank you. Jerry, I see your hand. Hi. Oh, Miss Jerry, take your mute off, babe. There you are. I can't hear you.
Okay. Hi. In our organization, I work in the mental health field. And so they were barely starting a peer program here, where I work at Tri-City Mental Health in Pomona. So we had very few peers, maybe 5 during the time when the pandemic hit. But what we were doing, we were mostly in the field. So we were always looking for, wherever the clients were. Our responsibility was to try to bridge the gap, gain a relationship with those who weren't engaging in their mental health portion of treatment.
Yeah.
And by sharing our lived experience, and hopefully they would, start participating with their mental health with our support. Right? Okay, so we were in the field. We were at, we were wherever they were, 7-Elevens, homeless, bus stops, everywhere.
Yeah.
And so when the closure came about, what they did was they started equipping clients with cell phones. And to make sure staff had all laptops, cell phones, set everybody up to work from home. So all the running stopped. We're working from home, trying to call people via phone and all of that. And it was kind of, I don't know how to explain it, but working from home and living, it's like when your day is done, you're still sitting there. I used to have to get in my car and just leave.
Oh, I'm telling you, I am totally connecting with you right now.
Yeah.
I do not like to do this from my house. I will tell you that, hands down. I don't like to do it from my house. If I'm in my office, I'm safe. If I'm at home, and home is my safe space, but I can't separate the two things. And it's really difficult for me. So I get that, Jerry. Absolutely. Thank you for sharing that.
You're welcome. Yeah, it made it difficult to, really do what we needed as far as engaging and connecting, and made it difficult.
You explained it exactly that. That's this minute by minute change. This is all happening now. Phones, laptops, all that stuff was happening in that way. So I just felt I want to validate that. And there were a whole bunch of other things that were happening that I don't know that you recognize, the things that you had to metabolize. You had to metabolize policy changes, and it depended on the location, depended on the facility you were working in, the direction given by health and safety in your organization, and then outside of the organization from the CDC. How are those things meeting, and who's communicating with who? All these things are changing minute by minute. You had, got to wear a mask, and then you don't have to wear a mask. And then transmission by touch. No, it's not by touch. It's by air, or it's airborne, or it's making us work remotely, and then having half of us come back, and then having to communicate schedules because some of us had to work overnight, and because we're doing other coverage things. Some of us had to do jobs that we'd never done before. I'd never worked at the medical center before. I was like, okay, here I go. Right. They put me in the basement like a troll. It was awesome. It's a very, very weird time, let me just tell you. And then most of us had never used a virtual platform before. Most of us hardly, some of us can only, hunt and peck on the keyboard. We don't necessarily type really well. So this is minute by minute change and pushing ourselves to do this stuff. And then people are coming back to the office and it doesn't operate in any way, shape, or form the way it operated before we got there, because it's being led by either a person that normally wasn't leading, or the muscle memory is just wonky. So what happens to us when things continue to change continuously? What happens to us? And you can unmute and just say, what happens to us when this constant change, minute by minute, what happens to us just as humans?
It's just hard to relax, and you're just constantly scanning the horizon for the next threat.
Mm-hmm.
Exactly. That's what I was thinking, Libby. Like, what's next? You're living on the edge.
Right.
How are we going to get our bearings, and where do we go from here?
Like I remember one big question we were asking is it safe to touch your mail? What if there's coronavirus on it?
Yeah.
And so everything started coming into question, like, is it safe to brush your teeth? Is it safe to, we just didn't know.
I'm dropping trow in my entryway and I'm warning my family, naked mommy running through the house, because I was working at the medical center. I was in it. So I had to take this stuff off, and then I'm running upstairs, in my lily white self, upstairs to put on a robe or clothes or to take a shower or whatever. And it's because I was so worried about bringing it into my house. So all of this is changing.
Mm-hmm.
But then I want to talk about what else was changing, right? This you're talking about, I can't relax, I'm stressed, I'm thinking about all these things. So what was changing? I know for me, my daughter and her girlfriend lost her apartment and they had to move in with me. Okay, change, right? And then my best friend, she had to homeschool her kid. She's not a teacher. She's an accountant. She can't homeschool her kid. She's like, I don't know how to, I don't even do homework. My husband tries to do some of it, but I can do the math. So kids got to be homeschooled. The trust in the things that were changing for me was the trust in media outlets. I was like, I can't even look at media. I can't watch the news. I can't read Facebook. I actually walked away from people were leaning on social media at the time. And I was like, no.
Pumping up that fear.
Yeah.
Yeah.
And then the biggest thing that changed, I don't know if it happened with you guys, but my in-person support circle, my system, the system that I have in my support circle is actually in person. The way I'm fed is with people, humans, energy, touch, hugs, smooches, I'm squishy. Okay. I'm a squishy person. So not having that, the change of not having that, it's like losing like a part of yourself. And I had already been neglecting my friendships. So when I'm asking them to meet me for tea time on Saturday on a Zoom, when I have already been neglecting my relationships, how are they responding? Oh, there you are. It's about dang time. Right. So these are the things that we're changing. And I know that this is difficult because as peer support specialists, we support people through change. That's what we do. Right. Yes. Yeah, we do. Yeah. We're the evidence that recovery is possible. We role model that recovery and all that learning that we've done from our history and from our current, because some of us are still working on I'm a work in progress. Will be that way my whole life. But we're supporting people by facilitating a group and being in person and sharing that energy in the room. We're supporting individuals to learn new ways to wellness, right? And providing role modeling, staying hopeful and hope focused, recovery environments, creating them and making space for someone's safety, love, and support, allowing the person to take the lead. Well, all that stuff never changed. We're still in that role, but when we walk the walk and talk the talk, and then all this stuff is happening, what happens to us in this role? What happens to that ability to do these things when that occurs? You can unmute yourself, say whatever you want to say.
I just think it's harder for us to role model hope when we might not have that much hope.
Yeah.
Precisely.
Big struggle. Big struggle. Yeah.
And
have to try to find other ways to try to connect with that.
yeah.
That in person, it makes a big difference. It
Huge
does.
I wish I was in the room with all of you, because this piece, I think that we would connect. This is more like a group than it is like a presentation, because it's a discuss. I would rather it be more of a discussion, because this is a discussion, because in peer support, we learn from each other. And so me talking is not necessarily as helpful as it is if I'm hearing other people talk, but I appreciate those who are. Jerry, thank you very much. Kelsey and Miss Libby. So anybody else who wants to interject, I'm happy about that. So we have a practice like any other discipline. Our practice is something that we're indoctrinated into. Yes. Peer support practice is the practice of peer support. Yes. So we're bound by our code of ethics. We're bound by our core competencies to do all of these things. That's what we're bound to do. That's what we're supposed to do. And I know many of us struggled to do these things in the new environment that we were in, because the environment itself, the world, was not a safe place. And I think that needs validation. I feel I have the need to share that with you, to say that if you felt like these are things that you couldn't do during the pandemic, I want to validate that for you, because you weren't in a safe environment. Right. We were providing a welcoming environment and doing the best we could. But it's hard. It's hard to do when the world around you doesn't feel safe. Our role is never supposed to change. Never. I know, Libby, you're laughing, but it's true, right? Our role is never supposed to change. Our lived experience of recovery and wellness has taught us so much. We know that our roles never change with the people that we serve. We know that foundationally. We know that. We said we were going to be there for the people that we serve. The role is not supposed to change. We were being required to do things that we'd never done before, maybe not trained to do, and having to metabolize minute by minute change and to move and behave in different ways from one day to the next. It's stressful. And Libby said it. Libby said it. Like, I couldn't relax. It was impossible to relax. And I'm telling you, stress, it's a brain thing. It's absolutely a brain thing. And I did a little research about this during the pandemic, and something I remembered it when we were talking about I was going to give this presentation, and it wasn't complete. The middle part that we're talking about right now was not in this presentation. But after I going back and forth with Libby, I was like, oh, I remember this article. And this article is written by a Harvard University neuroscientist, Cyan Baylock. I don't know if you've heard of this person, but they wrote something about the prefrontal cortex, about stress or pressure, like pressure. She says, our prefrontal cortex, found in the part of your brain situated right above your eyes, right up here, is the epicenter of your cognitive horsepower, powering our ability to focus on the task at hand. When we are performing our normal practice tasks every day, we often are counterintuitively not paying attention at all to the little things, the little details of what we're doing. Our prefrontal cortex is running largely on autopilot. So I always like to use this example. Okay, so I drive 50 miles each way to work every day. I love my job. Okay, so I drive 50 miles, and there are days, I'm just being honest here. There are days that I pull into the parking lot and I go, how did I get here? My car basically drove itself, right? Because I was listening to music, and I've been driving that route for a decade. So it's autopilot. I know where to turn and how to change lanes. It's a freeway in the middle of Southern California. I'm changing lanes. I'm going on the fast track, the little, toll lanes or what. I can do all that stuff in autopilot. I don't even have to think about it. That's my prefrontal cortex working, right? Then she goes on to say, but in times of intense stress, like a playoff game, a major presentation, a job interview, or the constant change and uncertainty of pandemic era environments, your prefrontal cortex can go into overdrive. When the pressure's on, we often start focusing on the step-by-step details of our performance to try and ensure an optimal outcome. And as a result, we disrupt what would have been otherwise fluid and natural. Well, pressure. And then when the pressure's on, we tend to panic. And if we already have a panic disorder, right, or we already have an anxiety challenge, we already have something going on, imagine what would happen to us in terms of pressure and my prefrontal cortex. So the result is we apply too much cognitive horsepower to what we're doing. We start overthinking something, and that usually comes naturally to us. So even the simplest of changes would create chaos for many of us. So I want to say, okay, good on you, because look at, we're all here together right now, right? So then I go further to say, look, some people thrive under pressure. Okay, I'm that guy, just so you know, I'm that guy. I embrace challenge. I have a positive attitude most of the time, unless somebody cuts me off in traffic. I'm pretty resilient. I know that about myself. I'm proactive. I think about things. I'm pretty disciplined. I'm a good problem solver. I'm adaptable. And yes, I can focus. Okay, I can. I'm not going to say that I'm like that all the time, but when the pressure's on, people call on me and I'm the one who'll perform. I've been doing that my whole life. I'm conditioned to be that way. But that you might be the antithesis. That's a word. Antithesis of that. The anti-person who thrives under pressure, because some people do not thrive under pressure. They just need to stop. They need to just stop everything. The pressure's too much. I'm folding, or I have to step back. This is something I can't do right now. And that's okay too. And I'm going to ask you why. Why? Why would you think a person would not thrive under pressure?
Maybe they've been through something traumatic.
Beautiful. Yes, Angeline. Angeline, your hand's up. I can't hear you though.
Can you hear me now?
I can hear you now. Hello.
Thank you. Thank you for your program today. I greatly appreciate it, or your seminar. I'm not sure how we categorize it.
It's just a conversation.
But on the pressure, I dealt with an older brother I took care of many years, and he couldn't take the pressure of not getting the proper mental health.
Mm-hmm.
And he basically was like those babies in the hospital that turned their head to the wall and died. He just gave up. Because he was in the hospital, they used to say to him, "Oh, you need $1 to call your sister." He didn't have $1, and he was mental.
Yeah.
And he didn't understand, like your first word, why? Why are you doing this to me?
Yeah.
And every case manager was different. And this is before we had the peer support, which I am so thankful for this guy. I'm learning so much, and I wish he was here to be one of the peer supports, because he would be great. He was a friend of Bill W. for 34 years. But like you said, some people don't thrive, and I've learned to deal with pressure, and I learned it's my job. Like with yourselves, I'm learning to adapt. I'm learning to help and do whatever I can.
Well, thank you, Angeline. I appreciate that.
Thank you so much.
Yeah. There's a lot of whys. Jerry, you look like you wanted to say something.
I wanted to, because when you explained how you thrive under pressure, it came to me for me. I know we're talking about where you do not, but where I do thrive under pressure is because of my past trauma from the beatings that I would get from my stepfather. Yeah, for not doing things right or getting things done the way, so that's how, I got to do it. I got to get it right. I got to get it done. With that, I put on my own pressure now because of my lived experience with trauma.
Okay, so you and Libby said exactly what I was getting to. This is the next thing I'm going to talk about, because when we talk about people, thank you so much for that. And thank you for sharing that. I too have a trauma history, and I think that's why I do well in that respect. But some people who do not thrive, and why, one is because our recovery journey has taught us to practice our self-care and put up boundaries and say, I ain't gonna get pressured into this, right? So there's that part. And that I have to be trauma informed, right? And I have to honor voice and choice, right? With the people that I serve and myself. So I may not thrive under pressure because I'm self-caring. I'm looking after myself. That might be one angle to this, but you two nailed because trauma gives us these things that lie with us, that fear of the unknown, that pre-existing challenge of dealing with things that are triggering our trauma, the nervous system overload stuff that happens when we're under pressure, especially if we're being pressured by a certain type of person or circumstance. There's that specific traumatic experiences that come back when we're in an environment with that kind of pressure. And there's also that fight or flight response, which is, that's a good thing. It protects us. It's safety, right? So that might be why some of us did not thrive very well under that pressure, and that's okay. And I hear from more people all the time about kicking themselves about how they were during the pandemic. I'm like, stop that, because guess what? You get to, and you're still here. And you're still able to move through your life in a way where you're staying in your recovery. I'm okay with that, man. That's all right. So what did happen to us? What happened to us during that time? When we were on the other side of the height of the pandemic, once the pandemic sort of settled down. Now, I never say it's over because it ain't over. Okay, it's not over. But I'm saying that in this denouement, as we say in the theater, about the part where that goes downhill and the story is sort of ending, and this denouement, this de-escalation of what was happening. What have we as humans discovered about ourselves and our community? You can just say it if you want to. If you guys want to unmute. What happened to us?
I feel that I've learned how important it is to me to be part of a community, and how much I miss that. How what a contribution that makes to my life.
Mm-hmm.
I've also learned a lot about Zoom.
I learned that I can drive things. I can learn new things.
Yes.
That part, yeah, that you can still thrive. You can change with the change and make it work. Yeah.
Yeah. We can do hard things, y'all.
Mm-hmm.
Yeah, we can do really hard things. And we've discovered that the strength of the human condition can be stretched beyond limits that we thought were even, possible. That human condition. Now, I want to talk about the human condition. I want to talk about the stuff. The human condition is affected by so much, and there was so much lost during the pandemic. And I want to validate that for any of you who lost family. I mean, final loss of family, final loss of friends. I lost family. I lost friends. A friend of mine lost her business that she'd had for 30 years. People with chronic conditions, didn't get treatment. And some of them got really, really sick or became debilitated after all of that. High school rites of passage, gone. Graduation, prom, we don't get that back. So there's grief that's attached to all of this. The human condition, there's a lot of people that are still sitting in grief. And if we're not conscious of that amongst ourselves as a workforce, we're not going to be conscious of it about the people that we serve in the community. The isolation that it created, I notice in the world. And a friend of mine called me today just to check in. He's somebody I support in Seattle. And he called me and he said, I was at the grocery store yesterday And it was weird because I know most of the people in this neighborhood, and he's lived there for 25 years. And he goes, I was in the grocery store and I was doing my small talk like I always do, making eye contact with people, saying hello, and it feels different. And I said, yeah, that's the human condition post-pandemic, because people are in self-protection mode.
Mhm.
We've been kind of conditioned over the last couple of years to be in self-protection mode. At least that was an observation I made. And I said it to him out loud. And I went, oh, I got to put that in the presentation.
Mhm.
I was like, I've got to talk about that. Angeline, your hand is up. Go ahead.
How do we get out of that rut? Because we need people.
Right. Absolutely. We do need people. We have to start joining whatever community organizations that we have that are in common with our goals, or in common with our beliefs, or our hobbies. I have a music sharing group where we play vinyl together. We do it in person now, but we were doing it online because I've collected vinyl forever. And we had a theme, like every 2 weeks there was a theme. Like the last theme was teen angst. Like what songs will display teen angst. And I picked a song by Toto that was just like this lyrical, ballad of brokenheartedness that was just so drama. But it's great. And we do this and we connect in this way. But it's important that not to expect it to come to you, but if your creative mind comes up with something that brings you into a room with other people that might have the same interests as you, that is a way to break down that isolation. And we were getting really creative during the pandemic, but once everything got lifted, people were stepping back from that. And so I just, I want to say that we can actually push off of that isolation if we choose to.
Mhm.
That's fantastic. I think your next job should be a DJ, and we'll all come. Woohoo! Disco ball or whatever,
We
anything.
should have an annual record party.
That'd be fantastic. I got a bunch of old 45s a neighbor threw away when the
Oh,
farmer passed,
cool.
and I got them. And
Awesome.
and the old projectors with family movies, they just put them
Oh.
in the trash.
I know people do it all the time. So, okay. So the last thing on this that I want to just touch on, which is that systems moving forward out of sight. Systems, all the stuff that happens at the top of the food chain of our systems keeps going while we're all in this human condition. And I want to make sure that we understand that, because the state is moving on and has moved on with CalAIM. And that change to our systems is telling us, and that task in and of itself is unsurmountable. And peers in general, they're not necessarily involved in that change, but that change all affects you. It affects everybody working in the workforce, because the Department of Healthcare Services has put requirements on peer services under CalAIM. It's asked agencies to opt into peer certification and take advantage of Medi-Cal billing opportunities, to implement organized delivery of SUD treatment across a continuum of care. But when we provide folks with that service, with Medi-Cal peer support services, with those treatment, we actually can't bill unless we're certified. We can't bill Medi-Cal unless we're certified if we're doing SUD. And more than half of us do that. We do substance use treatment. Most of us, or if not half of us, are working in that environment. Well, it's forcing our hands. We don't get an opportunity to say no. And then the prioritization of Medi-Cal peer support certification for agencies that have opted in have put that additional pressure on people to make sure it's happening, because they're not capturing that. So the organizational change is in high gear. It's an absolute high gear. Most organizations kind of don't pay attention to the humans behind the scenes and how it might affect them. That's just a fact. We have to support each other, because the systems themselves, they're not really, when those marching orders go forward, there isn't attention to that equity piece about how everybody learns that information. It's just a fact. Now, we can influence that, right? And some of us are on committees and we work on equity inclusion. I do that all the time. It's part of my work, but I know that a fact's a fact. There is a lack of compassion when it comes to, we got to get paid for what we're doing. There's no compassion that lives there. Okay. And recovery oriented approaches are kind of the 5th thing on a list of 6. Okay. When it comes to that sort of thing. So what do we do with that? How many of your agencies started trauma-informed services activities after everybody came back to the office? How many of you guys did that? Well, I know we did. Because there was such a sense of the employees going, you need to take better care of us. This isn't working because we're not doing very well because this is just too much. And then that same, I put that slide in again because the pressure that was put on these systems to make these changes just around billing, the billing stuff from the fiscal side, from the electronic record, from the peers knowing what bill codes to use, all those activities that are now billable that were not, all that stuff has to be like learned and worked through. And that creates pressure again, right?
I can comment on that.
Yeah.
Where I work at, we're only a team of 11, but 10 of us are certified. I'm actually going into a meeting this evening that has to do with us starting to bill. I'm having anxiety about that because of the CalAIM and the people that have left, and they have the pressure that are in that are the actual therapeutic, the ones that are the therapists and what they can only bill for now, and trying to push things towards us, thinking, they're pushing things up, but now we have a different plate, and I have anxiety around what I'm going to hear today because we do so much.
I want to give you a little piece. I want to just give you a little piece. So one of the things I always encourage peer groups to do is to create a duty statement for their peers. Write the duty statement. These are the things that they are to do. And that duty statement's got to be clear. It's got to be specific. It's got to be program centric. Like if it's for forensics, make sure you're dealing with the stuff that has to do with justice involved individuals and that culture and all that stuff. So they have to be there. And then they have to sit with state and federal law, making sure that mandated reporting is part of it. And that peer support code of ethics is part of it. And then framed in the language of your practice. So that duty statement, when shared to leadership, supervisors, administrators, that stuff is clear. And what's nice is, and what I want to give you some hope, because the BHIN, it's like 22046, I think, if I remember right. 22-0046, I think. It has the peer support billable activities. And they speak in terms of therapeutic activities, engagement activities, and education groups. And the blurbs under them are huge, and they apply to families and the loved ones, the people that you're serving. It's not just the person you're serving. Actually, so you know, the umbrella of billing stuff that we can do got 10 times bigger. 10 times bigger.
Okay.
So yeah. The clinical staff are going to look to you and say, okay, if it's not therapy, if there's something you could be doing with the person that you're serving, as opposed to, you don't do things for your person, right? You do them with them. That's our role, right? We don't do or for, we do with. So if I'm doing something with a person I'm serving, I get to bill for that. I'm sharing my lived experience. I'm opening my little gifts of my lived experiences for you to show you, and then to brainstorm with you about what it is that you want to do. These are the things that we're doing. We can get paid for it.
Okay.
That's beautiful. And it makes it a lot easier. So I'm telling you this because that's been our experience.
Okay.
We've even gone so far as to have engagement services. We're doing screenings in the lobby, and we're able to bill for that because there's no diagnosis. We don't have to diagnose somebody to serve them. I'm not diagnosing. I'm going to use a Z code, and I'm going to tell them, okay, we're going to open this guy, and we got 90 days to be able to assess him. So we're just going to do our thing. So just keep that in mind.
Okay, thank you.
Peace and solace. And then the other thing is that if you're going to talk about this and do this, make sure you are assigning appropriate mentors for new people. So if you have
Okay.
new people that are going to get involved in that billing process, make sure you got people who know how to do this assigned to other people who may not know as much about it. And you give them a role that's not punitive, right? You define that role. Maybe you make them a duty statement that says, this is your role as the mentor, we call them senior peers here in Riverside County. They're senior peers because they have seniority, they've been here for a while, or they have a large skill set in terms of how they apply their peer support in specific environments. And that non-punitive role means that they don't have any HR stuff. They don't do what the supervisors do. They're just there to support. And they're there to support the supervisor if a peer is not being very successful on the job. They're having some challenges. That mentor can sit with them and provide them peer support on the job. And then having ongoing training support for both roles, the peer role, the mentor role, the senior role, those are important to put in place. That takes pressure off,
Okay.
right?
Yeah.
Okay, so now the opportunities in clinics are huge now. Now it's huge because peers are more and more looked to as a resource. Jerry, you said it, that clinicians are asking us to do things. Yeah, because they're recognizing us as a resource as long as they don't use us in inappropriate ways and pull us out of scope. And then timely service is something we get pressure about. Like, okay, a person had to wait 2 weeks or 3 weeks or 6 weeks for their appointment. Well, if they meet with a peer first, there's timeliness. Happens just like that. So there are all kinds of things that there are opportunities in the clinic that we can actually use. And really, bottom line, the peer is the hope barometer. They really are. I mean, an environment itself can lose hope. And what our role really is to point it out. It's saying, you know what, this room is dirty. There's trash on the floor. The walls need to be washed. Maybe they need to be painted, because this is really sad. Can we put a butterfly in the lobby? These are things that we can do to help take that negativity away and bring the lightness as opposed to pressure to a space. And then I want to say this. I'll bet most of us recently have encountered a person who would normally not identify as peer. I will tell you, it has happened to me more times in the last 6 months of a therapist or even a physician, a nurse practitioner coming to me saying, I discovered that I have really severe anxiety and I didn't realize that I was a peer. I mean, and I go, well, you're a peer when you recognize that compassion has been given you and you've learned something from what you've experienced. What have you learned? And then they'll tell me what they learned about themselves and how resilient they could be. And coming out, and I'm like, yep, you're a peer. You're a peer because you know how to give it back. You know how to pay it forward. You know how to be a person to be compassionate with another person. Maybe looking at them with compassion goggles, as I say in my old vernacular. Angeline, what you got?
Do you write a book of all these positive quotes you have? Or is that your next job?
I've been published in a couple of books. I think people quoted me all over the place, and I'm okay with that.
That's nice.
Thank you.
Welcome.
All right. So when we recognize what
S. Gutierrez has a question.
Oh, go for it. I'm so sorry. I missed it.
S. Gutierrez asks for a copy of your slides.
Oh, of course. And Libby, I'll send you this updated one because I updated it.
Okay. I want to let everybody know we will, for everyone that we have their slides, we will post them along with a recording of the session.
Copy of your PowerPoint. Great knowledge sharing today. Oh, I got it. Okay. I was just looking at the chat. Sorry. It's on my left and I wasn't looking at it. I was looking at all of your beautiful faces that I can see. Okay. So someone showed the person, this is how I take it. Like the person who came to me and told me this is a nurse practitioner, said, someone showed them that their vulnerability was a strength.
Mm.
And they supported them, and they're recognizing that they got that support. We recognize that mutual connection between us and the kindness in the worst circumstances. And when we do that, it affects change. Truly. So forward motion. Oopsie, I got to click this again. Goodness gracious. Oh, I got another chat. Hold on. Hold, please. Oh, thank you, Libby. Yes, there you go. I'm going to close this. Okay. So the forward motion can be good. Now, I couldn't think of anything more creative to put in this picture frame. It says change, big deal. Okay, who cares? We've been talking about change this whole time. One of the things I want to do is, I haven't done it yet, but I want to take our code of ethics and blow it up and put it in a big frame and put it in an office where clinical staff have to walk by it constantly. So they can actually see and read what we're expected to be, do, and know as peers. I'm noticing that since all of this occurred, that supervisors and administrators are participating in more recovery-oriented training things. I'm noticing that. That's something I notice. This is your moment. This is your moment and opportunity to really shine, to be the voice of the person who's resilient and hopeful and remembers where you came from. The pandemic created all kinds of new remembrances for us, and we could be stopped in our tracks from them, but we're not. We're still sitting here, and we're still there for the community. We are still there for the people that we serve and for each other. And, you know, we can create and influence workplaces that are loving and kind and recognize someone being wounded or frightened. We have that ability, and understanding our values and ethics. If our whole systems understood our values and ethics, they'd be coming forth to us more frequently. They would see our value, and they would really put our work into play if they haven't already, and in ways where maybe they hadn't before. I'm going to say this to you now. I am part of a project, the first of its kind, to put peer support in a medical environment.
Mm.
Right now, in September, I'm going to start training respiratory therapists, nurses, physicians, surgeons, the practice of peer support from a trauma lens, moral injury lens. I'm speechless. I don't have words about how it feels to be in a space where this change that we all have experienced and we all know about, bringing it to an environment where people are going to be forced to take off their scrubs, forced to be humans with one another when they're trained not to be, through their entire indoctrination. It's a good time to be a peer after everything we've been through. So that foundation again, DHCS has given us oversight in terms of telling systems we're here, we're peer, and we're not going anywhere. Public behavioral health is embracing this. Our mental health systems, complete with peers, embedded in programs, in teams, is happening everywhere in California. Substance use treatment, you can't do peer support unless you're getting paid for it. You have physical health now where people are bringing in CSWs, which are community health workers who come from the community but may have a health condition. That peer work is happening. Our hospitals, like I just mentioned, that care for the caregiver stuff I'm working on right now, it's extraordinary, because we know when we have community-based providers and public health systems that work together, we just get better outcomes. Bottom line. And we know this. So that concludes my little conversation with all y'all, but that's me and my compassion goggles. Those are in my car for when people cut me off. I put them off instead of cursing under my breath. I put them on and say, I wonder what they're going through. Any questions? Anything you'd like to say? You get the floor. I just thank you for your time and attention. It's been fun.
Thank you so much, Shannon. It's really been a great conversation and touches on a lot of things that I know I've experienced and my organization has been through, and it just feels very, very relevant. Definitely getting some love there in the chat, a number of people thanking you. So I know that this is something that it's really touched us all in different ways. In my organization, we had about 5,000 visits every month, across of our 3 locations. And it's so much smaller now in person. We're still getting a lot of online participation, but we're really trying to make it inviting and attractive to come back in person and connect. One of the things we're doing is we're having an upcoming volunteer day. We're going to try and celebrate Lunar New Year in February.
Oh, that's great.
We're just trying to be creative about how we can celebrate and bring people together to enjoy being together instead of being fearful. And it's an ongoing process. So, just managing this time of change. Will that be February 3rd? Someone asked. The Lunar New Year is, I believe it's February 10th. That's a Saturday. And then the following Saturday, the 17th, is the volunteer day. So those of you that are in the Los Angeles area, I invite you. Come by. We're going to try and we have this, they have a tradition in some Asian countries of having lion dancing, and we have a lion dancing costume. So we might be able to kind of play with that and just learn about a different culture. So, I think finding things that people can get excited about and participate in that don't have to do maybe with a lot of dark conversation.
Yeah, absolutely. Absolutely. Yeah. I hope the dark conversation we had today was at least uplifting and reminding you of your resiliency. That was really the goal.
Yeah, I mean, I have to say, one beautiful thing that came out of this experience for me is that my parents immigrated from another country, and we started having weekly Zoom calls with my extended family, and we kind of got to know each other through these calls. And then last year, for the first time ever, we had a family gathering on Christmas, which it's like my family members had never met each other. A lot of them didn't know each other's names. And we had a group of us, like 30 of us in one room, and just able to meet each other's kids. And it was really, special. We took photographs of everybody's lineage, like the grandparent, the great grandparent, whoever is still alive, we had them in these group shots. And so we've documented that for everybody. And so anyway, it was a positive.
I love that. That's wonderful. Anybody else want to share anything? Yay, peer support helps to finish the job. Yes, Hung Lee. Oh, I got something else. Oh, from S. Gutierrez. Thank you for sharing your lived experience and never forgetting where you come from. Now that you're fancy, he didn't say fancy, I did, fancy deputy director and executive position to keep on speaking and educating people about who we are and what we do. Kudos to you. Thank you so much. I appreciate that. Dude, I'm just somebody who puts her pants on one leg at a time. And I'm lucky if I got pants on, I check. And I check my shoes, because when I find a good pair of shoes, I buy them in 2 colors, and sometimes I'll come to work with 2 different shoes. But I thank you all for your kind words. Oh, Angeline's got her hand up.
You could be like my husband and I sometimes, or my daughters. You forget to take your slippers off and you wear them to work.
Oh no, I've gotten in the shower with my slippers on.
Oh wow.
Just get in the shower and I'm like, oh, guess I should have taken those off.
You're an enlightenment. Thank you so much. Thank you, Libby, too.
Indeed. Thank you, Shannon, and for all of you for being here, for witnessing, and for participating in this important conversation about coming through this pandemic.